Sure. A very
A
good
very
morning,
good morning.
myself, Dr. Atul. I welcome you all to this Saturday morning CME. And on behalf of the Department of Medical Education, today morning CME will be conducted by Department of Biochemistry. We have Dr. Neeraj Gupta, who is Assistant Professor, Department of Biochemistry, and he will be talking upon a topic which is of interest for all of us. So he'll be talking on sunlight and vitamin D, a global perspective for health. So I request Dr. Neeraj to kindly take over the session and enlighten us. Dr. Neeraj, please.
Thank you so much, sir. A very good morning to you all. A very good morning to respected Pro-Vice Chancellor, sir, Dean, sir, MS, sir, and all my dear faculty members. This morning, I will be presenting this CME on the sunlight and vitamin D, focusing on a global perspective for health. Now, in all cultures around the world, sun worship has been practiced for throughout the ages for various reasons, whether it is religion, health, or prosperity. Now, in Hinduism, sun god has been considered very sacred and the deity for health. The practice of Surya Arga has been followed by Hindus religiously from generations, and for many, it has become the routine practice of their daily life. This slide shows an Egyptian painting showing the pharaoh and the queen being exposed to the sunshine. So the importance of sunlight has been known to the human civilization from very early times. Now in this presentation, I would like to present the contemporary perspective on the importance of sunlight in human health in general and what the modern science knows about it. Let's first begin with sun-controlled cutaneous production of vitamin D3. Now, during exposure to sunlight, the wavelengths of 290 to 315 nanometer, which is which is designated as UVB spectrum, penetrates into the skin layer and activates the double bond of the B ring of 7-dehydrocholesterol and opens it up to form pre-vitamin D3. Now, this pre-vitamin D3 is quite unstable and it rearranges its double bonds to form vitamin D3, which is more thermodynamically stable and flexible. Now, because of its flexibility, it ejects out of the plasma membrane into the extracellular space, and then it diffuses into the capillary beds in the dermis, where that get bound to the vitamin D binding protein, and then it travels the bloodstream, and then it moves to liver, where it be further hydroxylated and undergoes its first hydroxylation to form calcidiol. And then it goes into the kidney, and where it will get its second hydroxylation and form 125 dihydroxy vitamin D3 or calcitriol, which is its active form. Now, so this was in brief its formation. Now let me share some important facts. So during sunlight exposure, only 15% of the 7-dehydrocholesterol in the skin is converted to pre-vitamin D3. Now the rest of it is converted to other photoproducts, for example, luminestrol, tachysterol, and these products don't have any role in calcium metabolism. If the person exposes itself to further sunlight, so this will result in photoequilibrium, and vitamin D3 is converted to these photoproducts or is reverted back to 7-dehydrocholesterol. So in addition, pre-vitamin D3 can also be converted to suprasterols, these are other photoproducts, or to 5,6 trans vitamin D3, or several toxysterols. The importance of these photoproducts I will just discuss in a moment. Now, biological effect of these photoproducts. Now, these myriads of photoproducts have other biological effects, such as regulating epidermal cell growth and reducing risk of skin cancer. Now, in one of the experimental study, the human keratinocytes was treated with different types of suprasterols, where suprasterol 5 and 6 demonstrated anti-proliferative properties. Now, this slide shows the percentage of growth compared to the controls, and as you can see, suprasterol 5 and 6 has quite anti-proliferative action. Here, vitamin D3 is acting as a positive control. So luminestrol gets further converted to 125 dihydroxyluminestrol, which has been seen to have anti-tumor effects in skin. So therefore, no matter how much sun a human is exposed to, vitamin D intoxication will not occur because of sun exposure itself. Besides, the photoproducts generated may have additional benefits above and beyond simply taking vitamin D supplements. So sunlight has its additional benefits. Now, what is the relationship between vitamin D and sun exposure? So there is little information available how much sunlight is necessary to make enough vitamin D3. Robert Skagg and their team found a non-linear association between sun exposure and vitamin D formation. They suggested that that vitamin D status is increased by regular small sun exposures, that is less than 2 standard ethymal dose per week. And greater exposure will only increase little vitamin D3. So it is better to have small incidental exposures. So these studies recommend that one should be able to achieve adequate vitamin D levels through regular incidental, which is happening by itself. But we must have some regular short outdoor UV exposures outside the peak UV times. So a person with darker skin, for example, type 5 or 6, will need up to approximately 20 minutes of sun exposure each day before 11 a.m. and after 4 p.m. to face, hand, forearms to achieve adequate vitamin D levels. Now, deliberate exposure at UV peak time is not recommended, as this increases the risk of skin cancer, eye damage, and photoaging. I have found this website which is quite helpful. So you can go here on weatheronline.in, and I'm just showing you this location of our area, and it is showing the UV index. So UV index is the amount of sun radiation which is reaching the surface at the maximum time around midday, and it also gives this.
डॉक्टर नीरज, आपका वॉल्यूम कम आ रहा है साउंड.
I can come a little bit closer, I think. Yeah, that is the best I can do. Is it better now?
Yeah, yes, little better.
Yeah. So here you will also find this legend which has just shown, which shows the UV index in first column, and according to the skin types, it will show you the risk of damage to the skin. So you can check what is the UV index for your area today, and then according to the skin type, you can see how much is the risk. And so this chart can be very, very helpful. Now, there is sometimes a question that whether ingesting vitamin D from the diet or from the supplement is the same as producing vitamin D3 in the skin. So let's see what the studies have shown. Now, in this study, the same healthy 31-year-old female received 50,000 IU of vitamin D3, and 4 weeks later received a whole body exposure of around 0.75 minimum erythema dose of UVB radiation. So blood samples were collected for around 168 hours, that is around 7 days, and was measured using HPLC. And as you can see, it was observed that vitamin D generated by sunlight exposure lasted 2 to 3 times longer as compared to the dietary supplement. So as you can see, after 168 days, 50,000 IUs which were taken by diet or supplement as a supplement reduced to level 0, but whatever the vitamin D exposure was given, it is lasting 2 to 3 times longer. So I can add another point. So by exposing yourself to sunlight, not only you are getting additional photo products, but also the vitamin D produced will last longer. So let me now discuss some of the factors which affects the vitamin D synthesis. First factor I will discuss is latitude of the place where you are located on the earth. Now this latitude has a quite significant effect, because you see it all depends on how much UVB reaches to that place. Now if we come back to the spectrum again, so all of the UVC, that is from 200 to 280 nanometer, and all of the UVB radiation up to 290 nanometer is efficiently absorbed in the stratospheric ozone layer. That is 100% absorption. In addition, the ozone layer absorbs approximately 99% of UVB with wavelength 291 to 320 nanometer. And therefore, only 1% of solar UVB radiation ever reaches the Earth's surface, even in the summer at noontime. So we are just receiving only 1% of UVB radiation. So, and let's see the Earth and the angle of isolation, that is the insolation, sorry. So this is the angle which the rays makes to the surface of the Earth. And as you can see from this diagram, as you move away from the latitude, this angle decreases and it takes a longer path for the rays to reach the Earth's surface. So it is seen that beyond 33° north or south, there is no vitamin D produced during winters above these latitudes. So it will be quite, if you are staying or born in near and around the equator, you can think yourself be quite lucky. Now, this is the vitamin D production in various countries which are beyond these latitudes. And as you can see, we are having a typical U-shaped curve here. It can be seen that there is no or little vitamin D formation beyond these latitudes in the two hemispheres. Also, it was further observed by Jitterman.
डॉक्टर नीरज, आपकी आवाज अच्छी नहीं आ रही. Others are listening, okay?
Yes, ma'am. It's quite clear.
बाकी लोगों को आ
Yes,
रही है?
ma'am. Yes, ma'am. It's good on our side.
Yeah, ma'am, it's clear here.
I don't know. I'm not able to hear. No problem.
Maybe
Okay, you can.
I'll adjust my
problem
mic
at
a little
your
bit
end.
more.
Otherwise, clear.
Now, it was also further observed by Jitterman and colleagues who observed a negative correlation between latitude and serum vitamin D levels in subjects of various age groups. So latitude has a dramatic influence on the cutaneous vitamin D production and therefore on the vitamin D status of people. Now, next factor which I would like to discuss is air pollution. So even if we are living near equator and getting good sunlight, but in case the air is polluted with the gases like nitrous oxide and sulfur dioxide, so these will absorb UVB light, which will hamper its availability to the Earth's surface. And as you all know, air pollution is quite common in metro cities. And in winters in Delhi, I have seen that it's very hard to see the sun. And therefore, it will decrease the production of vitamin D in the population living in these cities. So altitude is another factor which is having a dramatic influence on the amount of UVB that reaches the Earth's surface. So in this study, 27° north was taken, and several places on different altitudes, the vitamin D level was measured in the month of November at 28° north. So in this study, it was seen that if you compare the vitamin D in Agra and in the Everest base camp, which was 5,300 meters above sea levels, there was 5-fold increase in the photoproducts. Now, another factor is the skin pigment. So melanin, we humans have evolved near equator and developed a natural pigment, that is melanin, which has a absorption spectra of 290 to 700 nanometer. So this effectively absorbs the UVB radiation. Before we move further, let me give you a quick run through the classification of various skin types. So they are classified from type 1 to 6 with increased melanin concentration, resistance to sunburn, and increased tanning as we move from type 1 to type 6. So type 1 will always burn, does not tan. Type 2 will burn easily, tans poorly. Type 3 tans after initial burn. Type 4 burns minimally, tans easily. Type 5 rarely burns, tans darkly. And type 6 never burns but tans darkly. So if we summarize, so from type 1 to 6, there is increase in resistance to sunburn and more prone to tanning. Though type 6 is quite heavily pigmented, but still UVB radiation is able to penetrate the epidermis to form vitamin D, but to a small extent. So how small extent? This was explored in one of the studies. And it was seen that when light colored skin, for example, type 2 and colored skin type 5 was exposed to sunlight for 30 minutes, there was 10 times vitamin D formation in the light colored skin. Now, this shows a positive association between skin lightness and vitamin D formation. So this means that if you are light color individual, you need less time, less UV exposure to form the vitamin D. Next factor I want to talk about is aging. Now, it is seen that 7-dehydrocholesterol concentration, that is the raw material, in human epidermis is inversely related to age. So its concentration is less. So if it is less, then less amount of vitamin D will be formed. So this was seen in another study where a group of healthy young adults and aged individuals were exposed to the same amount of UVB radiation in a tanning bed, and found that young group had around 3 times higher blood levels of vitamin D as compared to the age group. Now, another factor, important factor, which is in our day-to-day life is glass. So glass has the property to absorb all UVB radiation. Therefore, if a skin is exposed to sunlight that passes through glass or plexiglass or plastic, this will not result in any production of vitamin D3 in the skin. So here I'm showing you the transmission of UVB radiation through air, glass, and plastic. And as it can be seen, there is drastic reduction of UVB by these barriers. So on the top is just the air, then it is glass, plastic glass, plexiglass. So UVB is quite drastically reduced. And in this study, it was shown that how glass, plastic glass, or plexiglass prevented the formation of free vitamin D formation. Now, how this knowledge can be helpful? So this knowledge can be helpful when you are building your new house or thinking about constructing a sunroom. So be mindful that you need to create the architecture in such a manner so that unhampered or unhindered sunlight can reach you. So that will be only helpful if you want to have the full benefits of sunbath. Now let's look at some of the non-calcemic health benefits of sunlight. So in 1903, Neil Ryberg Finson received the Nobel Prize for treating lupus vulgaris. Now, lupus vulgaris is a skin lesion caused by tuberculous infection. He observed that by exposing the skin to sunlight, there was dramatic improvement in these lesions. Now, this led to the use of UVB radiation to treat tuberculosis patient and gave rise to the use of heliotherapy to improve health. Now, heliotherapy was used to treat a wide variety of chronic illnesses in early 1900, and it was practiced throughout the world and especially in Northern Europe. Heliotherapy was used to treat a wide variety of chronic illness, and as you can see, these are the old people in a nursing home and being exposed to UVB lamps. Now, but unfortunately, I will say that with the rise of pharmaceutical to treat acute and chronic diseases, it led to the demise of heliotherapy, especially in United States. So let's see some of the connection between sunlight and cancer. One of the first association studies relating to sun exposure with reduced skin cancer was reported in 1916 by Hoffman. Now, he reported that living at higher altitude was associated with increased risk for mortality from cancer. He compared the cancer mortality between 1908 and 1912 and observed that cancer mortality increased with increasing distance from the equator. So these are just the observation studies. In 1941, Apperly compared total cancer mortality in farmers of Americans and Canadians and found that cancer mortality was higher in farmers living in North who did not receive that amount of sunlight than in farmers living in South who were exposed to more sunlight and had lower mortality. They also developed immunity to all other cancers. These observations of increased sun exposure and reduced risk of cancer mortality was buried in the literature for 40 years. Until in 1980, Garland and his colleague reported that there was a strong negative correlation with colon cancer mortality and mean daily solar radiation in the United States. So after this observation, Garland, who conducted an 8-year prospective cohort study of adults living in the Washington County, and he reported that the risk of getting colon cancer decreased threefold in people with a serum vitamin D of more than 20 nanogram per ml. Now, these results were quite good, and this led to many observation studies, and it was found that people living in higher latitude receive less sunlight exposure, and the association with latitude and cancer mortality could be linked to an inverse relationship with cancer mortality and vitamin D status. So they suggested a possible role of sun-induced vitamin D synthesis and its beneficial factors. Now, further, a meta-analysis of studies reporting cancer incidence rate for more than 100 countries, including Australia, China, Japan, Spain, revealed an inverse relationship with solar UVB exposure for 15 types of cancer, including bladder, breast, cervical, colon, endometrial, esophageal, gastric, lung, ovarian, etc. So it was quite promising. In another interesting analytical study conducted by Wu et al. In 2005, reported that the patient who had undergone the prostate treatment and after that they were having increased prostate-specific antigen levels. When they were given vitamin D at the dose of 2000 units per day, they showed a significant decrease in the rate of PSA rise. So Lappy et al. Reported that more than 60% reduction in the development of all cancers in a small study of post-menopausal women who received calcium supplementation like 1500 milligram along with 1100 IU of vitamin D3 compared with the women who received placebo. So this is the Kaplan-Meier survival curves that is free of cancer. So these are the three groups compared with placebo. One group received only calcium with 445 patients, and one received calcium plus vitamin D. So calcium plus vitamin D shows the maximum free of cancer time period. Gorham et al. In 2007 did a quantitative meta-analysis on the optimal dose of vitamin D for colorectal cancer prevention and showed that a vitamin D level of 34 nanogram per ml was associated with 50% reduce risk of developing colorectal cancer. Later, Chung et al. In 2011, who was part of United States Preventive Service Task Force, concluded that for every 4 nanogram per ml increase in circulating concentration of vitamin D, there was 6% reduced risk of colorectal cancer. To summarize, all these observational and analytical studies suggest that vitamin D deficiency may increase the risk for cancer, and building up its level may provide protection. Now let's see some studies exploring the role of vitamin D in innate immunity. Now it has also been recognized that young children with rickets had much higher risk of developing pneumonia and upper respiratory tract infection, and were more likely to die of these diseases. Now, Sebzeta et al. In 2010 observed that healthy adults living in New England with vitamin D levels of 38 nanogram per ml, approximately half their risk of developing acute viral respiratory tract infection. Similarly, Urishima et al. In 2010 reported that school children in Japan who received 1200 IUs of vitamin D3 daily for 4 months during the winters reduced the risk of developing influenza by almost 42%. So Maxwell et al. Reported that risk of acquiring respiratory syncytial virus was 6-fold higher in infants who had a blood level of vitamin D less than 20 nanogram per ml compared with infants who had blood levels of more than 30 nanogram per ml. Now, these studies are probably indicating the role of vitamin D in enhancing the innate immunity. So what could be the mechanism of vitamin D in innate immunity? So one of the most possible mechanism that could be underlying the immunity enhancement by vitamin D is that we know that macrophages play an important role in fighting infectious disease by ingesting and destroying the microorganisms. So when a macrophage ingests an infectious agent, so for example, tuberculosis, toll-like receptors get activated, and initiate innate immune response. So one of the first response is the signal transduction to the nucleus to increase the expression of vitamin D receptor and 1-hydroxylase enzyme. So this will increase the interaction of vitamin D and vitamin D receptor. And once the vitamin D increases, so these interaction will increase the expression of cathelicidin. So this cathelicidin is a defensin protein. So this will go and increase the permeability in the membrane of the pathogen, and it will lead to and destroy it. So in one of the studies, so monocytes cultured in the serum of African American individuals who were deficient in vitamin D. So they mounted an ineffective cathelicidin mRNA response on exposure to tuberculosis. So however, if the plate was supplemented with the sera of 25 vitamin D, that is more than 30 nanogram per ml, so restored the toll-like receptor mediated induction of cathelicidin response. So when the sera plate was, these monocyte was supplemented, the sera from individuals whose vitamin D level was more than 30 nanogram per ml, so cathelicidin response was quite better. Now this experiment was further supported by Adam, what he did was, who either exogenously gave the sera or supplemented directly with vitamin D. Both the responses increase the cathelicidin response. So these data show that the importance of maintaining more than 30 nanogram per ml of vitamin D to generate an effective cathelicidin response. So to summarize, all these observations and analytical studies suggest that vitamin D strengthens innate immunity. Now let's see what is the role of vitamin D in autoimmunity. So it is interesting to read that a number of studies suggest that born or living near equator reduces the number of autoimmune diseases. Now there are several association studies which have shown that being born. So in one of the studies, it has shown that being born and living for the first 10 years of life at a latitude of around 40 degree north compared with 33 degree north increases a person's risk of developing multiple sclerosis by 100%. So living far from equator has been found to increase the risk of multiple sclerosis. Now, if we review this information in Indian context, India lies between 8 to 37 degree north. And if we see the prevalence of multiple sclerosis, so it was around 1.33 in 1985 and 8.35 in 2014. And if we place this in the chart, we will see we are falling into quite safe zone. Next, we move to type 1 diabetes. So Mohar et al. Reported an impressive U-shaped curve when the incident rates of type 1 diabetes per 100,000 young boys of less than 14 years of age around the world were plotted against latitude. Now, children younger than 14 years during 1990 and 1994 in 51 regions around the world demonstrated a 10 to 15-fold increase in risk of developing type 1 diabetes if they were born in far north or southern latitudes. Now, in another interesting study from Finland, so children who received 2000 IU of vitamin D per day in first year of life reduced the risk of diabetes mellitus type 1 later by 88%. Now, what happened was that there was some concern that this dose may be quite high for the young baby. And so they reduced the dose from 2000 to 1000 and then later to 400 IU per day. Now, this was followed by increase in the incidence of type 1 diabetes in Finland over the past 3 decades. So what could be the mechanism of vitamin D in autoimmune disease? So activated T and B cell expresses vitamin D receptors and responds to immunomodulatory activity of vitamin D. In B cells, vitamin D downregulates immunoglobulin synthesis and B cell memory, decreasing the antibody production. Vitamin D decreases T cell proliferation as well. Vitamin D downregulates pro-inflammatory cytokinins and interleukins such as interleukin 2, 4, 8, 12, human necrosis factor alpha, interferon gamma, and upregulates anti-inflammatory interleukins such as interleukin 10. Now let's look at some of the connection between vitamin D and cardiovascular health. Now in 1997, Rosted et al. Reported that there was an inverse association with latitude and prevalence of hypertension. So Cross et al. Reported that exposure to UVB radiation not only improves circulating vitamin D concentration by more than 160%, but also reduces both the systolic and diastolic blood pressure in patients with hypertension. So looking at the mechanism, so vitamin D suppresses the production of renin. Vitamin D receptor causes vascular smooth muscle relaxation by suppressing the renin-angiotensin-aldosterone axis. And it was also seen further that vitamin DR knockout mice have a dysregulation of renin-angiotensin-aldosterone axis. Further, it was seen that vitamin D receptor inhibits macrophage cholesterol uptake and form cell formation, thereby reducing risk of atherosclerotic plaque formation. Now, in this slide from diabetes patient, the top slide is vitamin D supplemented, and in the bottom it is deficient. And as you can see, there is form cell formation. So vitamin D deficiency increases risk for myocardial infarction by as much as 50%. Also, it is associated with more than 100% increased risk of mortality from heart attack. In USA, it has been estimated that 50 million teenagers are vitamin D deficient or insufficient, and there was associated with a 2.4-fold increase of high blood pressure. Now, two major contributing factors for cardiovascular disease are obesity and type 2 diabetes. Now, it is well known that there is an inverse relationship between serum vitamin D concentration and BMI, because obesity will lead to increase in BMI, and therefore vitamin D will be sequestered in the fat tissue, and which will decrease its concentration. Now, decrease in vitamin D in plasma is associated with increased risk of type 2 diabetes. Now, a study in nurses showed that a combined daily intake of more than 1200 milligram calcium and more than 800 IU of vitamin D was associated with a 33% lower risk of type 2 diabetes. So just by increasing the calcium and vitamin D, the type 2 diabetes risk was lowered. So Stark et al. Reported an inverse association between vitamin D status and diabetes. Now, a prospective study reported that risk of progression even from pre-type 2 diabetes to type 2 was reduced by around 23% for each 10 nanomole per liter increase in circulating vitamin D concentration. What could be the mechanism? So some of the possible mechanism could be that vitamin D acts on the beta cells and is a potential stimulator for insulin production. Also, vitamin D improves insulin sensitivity by upregulating insulin receptors. To summarize all these observations, an analytical study suggests that vitamin D improves cardiovascular health and decreases the risk of type 2 diabetes. Again, sunlight and vitamin D and mental health. Now, if you look at these two pictures, so which one of the days shown below do you prefer? We have just passed through the cold winters, and I'm sure that you don't have to be scientist or a doctor, even a common man will prefer a sunny day. And there is there will be a reason for that. Now let's have a look. So it has been observed that schizophrenia cases increases with latitude and has been associated with inadequate sun exposure. Now, schizophrenia is more common in Scandinavian countries. Winter births have been associated with increased risk for developing schizophrenia later in life. Now, Finnish males, infants who receive 2000 IU of vitamin D daily in first year of life, reduce the risk of schizophrenia by 77%. Many association studies have related vitamin D deficiency with increased risk for depression, Alzheimer's disease, epilepsy, and neurocognitive decline. So possible mechanism which can be acting for vitamin D could be vitamin D increases the serotonin levels. Vitamin D has been shown to stimulate amyloid B phagocytosis and clearance by macrophages in Alzheimer patients. To summarize, these observations further indicates that vitamin D has a positive role in maintaining mental health. Now let's look at what is the prevalence of vitamin D deficiency in India. According to this review article published in 2018 from AIIMS faculty, so the prevalence of vitamin D deficiency is from 80 to 90% according to the meta-analysis done by this study. Now, in this hospital-based study from 2018, which recruited around 1,000 women attending the OBS and Gynae clinic, and reported that the prevalence of vitamin D deficiency below 20 nanogram per ml was around 64%, and the level for the level vitamin D less than 30 nanogram per ml was around 98%. So this is a study from Agra. Another hospital-based study, so this measured the prevalence of vitamin D in different age groups in around 26,000 healthy individuals enrolled under executive health checkup at Medanta, the Med City, Gurgaon, over a period of 33 years, and reported that vitamin D deficiency for a level of less than 20 nanogram per ml was observed in 93% of the subject population. So this is very, very alarming. So what are the approaches for preventing and treating vitamin D deficiency? Now the Institute of Medicine is using the population model to recommend vitamin D dose for the prevention and treatment of vitamin D deficiency. For 0 to 1 year, 400 IU per day, for 1 to 7, 600, and 70 plus around 800 IU per day. The Endocrine Society has used a medical model and has recommended ranges rather than an absolute amount for various age groups ranging from 400 to 1000 for 0 to 1 year, for 1 to 18 around 600 to 1000, and 18 plus 1500 to 2000 units per day, IU per day. Now, infants should receive around 400 IU of vitamin D soon after they are born. Now, rickets should be treated aggressively, 2 to 6 lakhs IU of oral vitamin D with adequate dietary calcium as single day therapy or daily dose of 2000 to 4000 IUs per day for 3 to 6 months. Infants and toddlers can be given 50,000 IUs of vitamin D3 per week or 2000 IU of vitamin D3 daily for 6 weeks without any untoward side effects. One recommended strategy is to fill the vitamin D gap with 50,000 IU of vitamin D every week for 8 weeks. And to prevent recurrence, one should take 50,000 IU of vitamin D every 2 weeks forever. I think I will repeat this again. To prevent recurrence, one should take 50,000 IU of vitamin D every 2 weeks forever. Now, patient with BMI more than 30 needs to have 3 to 5 times vitamin D for treatment and prevention. Patients with malabsorption syndrome who had gastric bypass surgery may require 50,000 IU vitamin D at least up to 7 times a week. Patients being treated on glucocorticoids, anti-seizure medication, and aid medication may also need more vitamin D to both treat and prevent vitamin D deficiency. So there can be some concern about vitamin D intoxication. Now, vitamin D intoxication is rare and is not observed until it is more than 200 nanogram per ml. Circulating concentration of vitamin D up to 100 nanogram per ml is safe. And as I have said before, any amount of sun exposure will never cause vitamin D intoxication. Vitamin D intoxication, if ever happens, is associated with hypercalcemia, hyperphosphatemia, suppression of parathyroid, soft tissue calcinosis, especially of blood vessels. In case there is vitamin D excess, what you will do? You have to just simply stop all the sources of vitamin D and maintain good hydration. This will normalize the calcium levels. I would like to quote this dosing error study. So where a 3-month baby was inadvertently given high dose of vitamin D for 20 days, and vitamin D concentration was more than 400 nanogram per ml. So it was well tolerated without significant change in serum calcium or phosphorus levels. So there was another reported case of a pregnant woman who received 4,000 IU of vitamin D per day throughout the pregnancy and showed no changes in either serum calcium or urinary calcium secretion. Now, infants given 2000 IU of vitamin D per day for the first year had no toxicity, plus for next 31 years markedly decreased their risk for type 1 diabetes. Now, what happened in the past? So in 1970s, sunscreens were introduced to protect against UVB. And over the past 4 decades, many health organizations has taken very radical approach and condemned the direct sun exposure and calling it carcinogenic. Now, this radical approach has led to the worldwide vitamin D deficiency pandemic. Now, the United States Center of Disease Control and Prevention, CDC, reported that 32% of children and adults have a circulating concentration of vitamin D less than 20 nanogram per ml. Similarly, reports from Mexico, South America, Europe, Asia, India, and even Africa suggest that more than 50% of world population is at risk of vitamin D deficiency. And I was surprised to read that more than 90% of healthcare professionals in India are vitamin D deficient. Now, if you look at Australia, which is the cancer, capital of the world, it is now recognized that the slip, slab, slope message has led to more than 40% of the population being vitamin D deficient. So there was, overdue of these messages. Now, CDC concluded that vitamin D deficiency is becoming more prominent due to obesity, decrease in vitamin D consumption, and increased sun protection. So what we can do, there is a 3-part strategy to prevent vitamin D deficiency. Have a sensible sun exposure, which is free of cost. Add, eating foods that are naturally containing vitamin D, salmons, eggs, fortified dairy products, fruit juices, mushrooms, and just for information, 1 microgram of vitamin D is equal to 40 IUs. Now, in our campus, this, I have just a little bit searched around. So this Varka, this milk is fortified for people who are not aware. So this is available in our SRHU campus if they are interested. It's not a promotion, but just to eye-opener that, yes, we can bring this milk in our daily life. It will help for the whole family. Similarly, in Uttaranchal, this is the product of Uttaranchal, this dairy product Anchal, which is again fortified. It is available in Dehradun, but it's not available in our place. I requested them to supply this to a D2H so we can be all benefited. So vitamin D supplements, of course. Now let's come to our SRHU. So we have this access to immunoassay, very efficient system, quite precise and accurate. So we are doing vitamin D assay on all days of the week. And this is the normal range of vitamin D showing you 2 units, nanogram per ml or nanomole per liter. So we are reporting in nanomole per liter, but it's a quick conversion. 1 nanomole per liter is equal to 0.4 nanogram per ml. So you can convert. And this is the crux. Try to maintain above 75, which is sufficient. 75 to 250 nanomole per liter, or 30 to 100 nanogram per ml. So try to get your patient or subjects in this range. So these are the number of vitamin D tests we did in the last year, each month. So on an average, we are doing 500 vitamin D tests per month. To conclude and further perspectives, we all know that vitamin D controls calcium metabolism and is good for our healthy bones. But also, it has many other benefits, that is reduced risk of cancer and mortality, strengthens innate immune health, provides autoimmunity, maintains cardiovascular health, protects mental health, reduces depression, neurocognitive dysfunction. Now, the role of vitamin D in our health seems unending. We are slowly understanding the role of sunlight and vitamin D in maintaining overall health. To conclude, there is no downside to increase vitamin D intake, and there could be substantial upside. That is improving not only the musculoskeletal health, but overall health and welfare. Data from a USA study estimated that as much as 25% of healthcare dollars would be saved just by improving the world's vitamin D status. What I will like to recommend from this seminar is to include vitamin D test as a routine in our annual health checkup for all SRHU employees. So this can be thought of, and if they are deficient, they can be supplemented. So this will help in improving the overall health of our employees and SRHU in general. Now, in the end, I would like to say that vitamin D is only a small part of the story. There are numerous other photo products whose role we need to yet discover, which may surely have many beneficial effects. Finally, our ancestor has rightly considered sun god as the deity of health, which definitely includes physical, mental, and spiritual domains. So I would like to take any questions if you have. Thank you for your attention.
Yeah. Thank you, Dr. Neeraj, for an elaborate talk about vitamin D. The house is open for any questions. Any questions or any suggestions, please?
Dr. Neeraj, I am Dr. Anita.
Yeah,
I
Atul.
just query.
Yes, ma'am.
Yeah, it is
Sir, Dr. Anita, madam. Yeah.
it is a fat soluble vitamin, we all know. So
Yes.
once we take vitamin D, it goes in our fat. So
Yes.
when you do estimation, it is from the blood serum. So does
Yes.
it affect the level? This query I have in mind.
Just, pardon ma'am, what was the last part?
Because we take the serum, which is circulating in the blood.
Yes, ma'am. Yeah.
And we do estimation from that, but while it is absorbed in our fat, which doesn't come in that. So does it have an impact in estimation? Are we taking some wrong method of estimation, and that is giving low vitamin D level practically 90% of the population of the world?
No, ma'am. As I have mentioned, so for example, it is a fat soluble vitamin, yes. So as I have mentioned that if there is increase in the obesity, the BMI, so this vitamin will go and settle in the fatty tissue, and it will decrease the serum levels. So we are measuring the serum levels here.
So does serum level is more effective for the estimation? What I mean,
yeah,
whatever we take.
We are measuring the serum levels, not the fat levels. And I think as per the study goes, the serum level should be in an appropriate more than 30 nanogram per ml, which will be effective as a whole.
So how does circulating vitamin D level will have effect on the different system? Because different system are those cells like liver or maybe marrow, maybe fat, maybe muscle.
Yeah, because you see, if it is deposited in the fat, so it is just localized. If it is in the serum, the circulating level, it can reach all the body tissues, and it may have its beneficial effects. As is seen in many studies, below certain concentration, it is not showing those effects, as I've mentioned. So if you remember the Finnish study, when they decreased from 2000 IU to 1000 and then to 400, it was not showing the beneficial effect. So these are some research studies which says that we need to maintain the level beyond a certain concentration that is required for its beneficial effects.
Okay.
Okay. Thank you. Dr. Maheshwari, sir, your question, please. Dr. Maheshwari, sir. Hello.
Dr. Gupta.
Yes,
हाँ
sir.
सर
Dr. Gupta.
सर बताएं सर
Yeah, I
we
just
can
want
hear
to
you, sir.
know
Yeah.
this whole literature search. Have you come across anything about the half-life of the vitamin D?
Very good question. So I have shown you one study in which if the vitamin D is taken orally as a supplement or is produced compared, in the study was compared either it is in sun exposure, is it conformed from the sun exposure or is in supplemented. So after 7 days, if you have taken it by supplement, so it reached the minimum level. So I'm not very sure, but I think from that study result, I may guess it is like 3 days or something like that. But I think I have to get back to you on this.
Yeah, because it is a fat-soluble vitamin. So might
Yeah.
be it is, as Dr. Anita had discussed, the serum level may goes down from one peak to lower level, but it remain inside the body as a storage.
Yeah, so if it is in the storage, then it may not have its biological effects. We need to maintain the serum level to up to its threshold concentration of like more than 30 nanomol per ml.
Dr. Neeraj,
Okay.
it has raised
Madam.
one query for me.
Yeah, ma'am.
Can I ask?
Yes, ma'am.
Because what we have learned, we store our whatever vitamins and things are there in our body, like in liver, it is there. So whenever there is a reduced level in the blood, it should come from the resources. So why it is not show for the vitamin D, which has gone in the fat?
Oh, you are saying that it should immediately equilibrate from the fat sources.
Yeah, it should come because we keep things on your storage. So for whenever there is a deficiency, it should come in the circulation. But why it is not so in the OBs, like it is there in excess amount. If we calculate the amount of total vitamin D concentration in the body of the OBs, it will be definitely more. It should come in the circulation, but why it is not so?
Yeah, quite interesting question. So I think I have to get back on this because you see, once it has gone into the fat, so there may be some factors which is not allowing the equilibrium from the fatty tissue to the blood level. Yeah, thank you, ma'am. I have to actually get back to you on this.
Then I'll.
We'll take
Okay.
Yeah,
two
thank you,
questions.
ma'am. I will definitely get back to you.
We'll get back to you, madam. Madam, Dr. Sadhana,
Okay, thank you.
we'll take up quick questions because already 9 o'clock has happened. Dr. Sadhana.
Yes, sir. Good morning, sir.
Thank you.
Good morning, everyone. I'm third year resident dermatology. Sir, as you mentioned that intermittent, inadvertent exposure to sun, especially over face and hands, they are more beneficial in increasing the vitamin D levels. I want to ask that if there is any other body site other than face that we can use for this intermittent exposure, because we have seen patients here in our OPD where they come with susceptibility to melasma and other skin dyspigmentation disorders, and they do tell us that they don't have that long exposure throughout the day to sun. They just go out for short time and they get such dyspigmentation and other disorders. So I want to ask that if face could be avoided and any other body site that we can use for this intermittent exposure that you talked of. Thank you.
Now, I have talked about intermittent exposure in terms of how much duration you need to be in the sun. So that was just about the duration, because you see, intermittent short incidental exposure would be enough to get the sufficient amount of vitamin D. So if you be there for a long time, that will only partially or in a small amount increase the vitamin D level. So my meaning was that, not if it is causing any, if it was not related to, because you see, if we are going out, if we are going, if we are going out, we are generally exposing our face, arms, hands only. So that short exposure would be enough. So if we consciously go and expose ourselves, so around 20 minutes for type 4 or 5 skin people would be enough.
Yeah, Dr. Neeraj, I request you to be a little crisp and short. We are already 9 o'clock and we have many more questions coming us.
Okay, thank
Somebody
you so
from
much. Thank you.
pharmacology
Sorry,
is asking. Somebody from the pharmacology
Yes,
department.
yes, please. I am Dr. Dasmana.
Sir, morning. Please बताएं.
Good morning. Thank you, Dr. Neeraj, for a very, very nice presentation. And of course, we got updated very well. One thing I wanted to ask you, that you have got so many data with you for vitamin D levels that you have measured in your lab. So what kind of profile you get in our patients here in our hospital?
So yeah, so very. I haven't, I have just collected the number of tests as we have done. So I have not done their profiling that how many are less than 20 or whatever. So then I think that would have become a study actually. So for that actually I have to put a research project. So I don't want to go in touch for that before your permission.
Okay, thank you.
Thank you.
Sure.
Okay, thank you, sir. Dr. Raki, please.
Ma'am, hello.
Hi. Dr. Raki.
Hello.
मैं अपना लास्ट क्वेश्चन पूछ लूंगा
Anita,
Yeah, I also
एक
have
सेकंड
ma'am, Anita, ma'am, I would like to
एक
say
हमारा
something regarding the estimation of vitamin D. Hello.
Is this Dr. Raki?
Hello.
Is this Dr. Raki?
Dr. Anita from Biochemistry Department.
Madam, please बताएं.
Ma'am, I want to say something regarding the estimation of vitamin D.
Okay.
You are talking about that the vitamin D is fat soluble.
yeah.
So basically, what we are estimating is the hello. What we are estimating is the vitamin D2. That is
Okay.
25 hydroxy polycalciferol, not the active form.
Okay.
Not the active form, that is calcitriol. Hello.
Okay. Yeah.
Yes.
Yeah.
Yes, ma'am. Because calcitriol has a very short half-life, and basically the major transporting form is the D2, vitamin D2. So we measure the vitamin D2 level in the serum.
Okay.
However, the active form is the D3, which have a very short half-life. So maybe this is a reason when it comes out in the circulation, releases from the adipose tissue and degraded easily.
Thank you, madam.
So I mean to say that the major portion we estimate is the D2 level, not the D3, because
Got it. Okay.
90% is the D2, which further gets converted into its active form, which have a 1 to 4. So that may be a reason. However, we can further find out what is the actual storage concentration or what is the actual amount of vitamin D when present in the adipose tissue, and what are the factors which can influence why does not contribute in the deficiency of vitamin D.
Ma'am, got your point. I'll just request cut short.
There must be some reason because.
No, I'll get back.
Madam, just last question on the CME, Dr. Hemant, please. Yeah, Dr. Hemant.
Last question. Yeah. Dr. Neeraj, nice presentation. I have just one practical question. Among the various preparations available in the market, I most commonly calcium citrate and calcium carbonate. in our bariatric patient, it is often calcium citrate is preferred due to better absorption. But the cost is quite high as compared to calcium carbonate preparations available. So do you see any advantage in normal population also? What are the main advantages of this citrate? And some studies have documented a better absorption in bypass patients.
No, what I will say is I haven't gone in the formulations, and because this will be like pharmacology aspect. But what I will say is if in our context price is quite a factor. So if the patients can just take whatever calcium supplements they can afford, that should be fine.
Okay.
Without going
So
into
there no
academic indulgence here.
no much you mean to say no very much significant advantage of calcium citrate preparations.
I mean, there
If
can
we compare,
be, there can be some advantage definitely in absorption and all. But if price is the factor and we
price is quite.
So it's better to have something rather than nothing, So in our population, I will say, yeah. Thank you.
Thank you.
Okay. Thank you, everyone, and Dr. Neeraj for such a nice presentation and a very interactive discussion. I thank you all for attending this morning CME, and I request you all to please log out of this session. Thank you, everyone.
Thank you so much. Thank you.
Thank you, Dr. Neeraj.